Welcome, and thank you for joining me today. I'm so grateful to have you here, sharing in this space of growth, healing, and transformation. If you've already subscribed to Loving Everything, thank you for being a part of this beautiful community. Your support means so much, and together, we're creating a space where love in all its forms can be explored and embraced. As you listen to this episode, if it resonates with you, I invite you to like the video and share it with anyone who might benefit from the insights we're diving into today. These conversations are all about expanding our capacity to love ourselves, each other, and the world around us. And if you enjoy what you hear, don't forget to explore my other episodes where we journey into love's deepest, most unconditional forms. Each one is an invitation to reconnect with the parts of yourself that are waiting to be seen, healed, and loved. So thank you for being here. Let's begin. Hi.
Hi.
Thank you so much for joining me today. I really, really appreciate it. I saw you speak at, was it Volunteers of America?
Volunteers of America, the
Yeah.
Alfortham Scholarship.
Yes. And the reason why I was really drawn to your work and what you've done with your clients and what you've done in practice is because I am also pursuing, as I told you, my master's in counseling, and I have a history of intimate partner violence, not personal violence. And I am leaning heavily towards this as a concentration or a field of interest that I want to specialize in. And so I really found listening to your compassionate approach really amazing. You've done this work for a very long time and have impacted so many lives, I can only imagine. So I can't wait to share all of that with everyone listening. And so I just want to thank you for the work that you do, first of all.
All right. Yes. Well, you're welcome, and it's been enjoyable work. I think when people hear that kind of work that I've been involved in, I do a lot of other things, but when I mention that, people will go, "Oh, that's so heavy. That must be depressing," or "Do they ever change?" And actually, I've been involved in this work for 40 years because it's actually some of the most hopeful work that I've done in my clinical practice.
Tell us more about that.
Well, it didn't necessarily start out that way, but as I was preparing for the presentation for the Alfortham Scholarship, I realized that almost everything that I did, that I'm currently doing with batterers, is 180 degrees different from what I did when I started. Everything has changed, and it makes it just much more enjoyable. And people who engage in interpartner violence, intimate partner violence, are coming from such dark places that the changes are more remarkable than almost anything I see in my practice.
Wow. That's awesome. Well, that was kind of my first question, is what drew you to the work of intimate partner violence intervention originally?
Well, it's one of the kind of happy accidents in my life. So when I was like 19 or 20, I started working volunteering for crisis hotlines here in Portland. And
you did?
Yes.
Okay.
And then some of the most frequent calls we get are from women who are in battering relationships.
Yeah.
And often even the same person calling over and over again.
Yeah.
With a crisis with the same partner. And so as I was reflecting on that work and going into the Master's in Social Work program at Portland State, they were asking me, what kind of work would you like to do in your field placement? And I said, well, there's this problem that women are calling about, and they aren't going to be leaving their partners. And it occurs to me that nobody is getting to the root of the problem, the issues with the partners. I don't know any place where that's done, but that would be a dream for me if I could find a place to really intervene at the root of the problem. And so with that information, they placed me at Men's Resource Center here in Portland, still operating. And just as a 25-year-old intern, got my start doing intakes and co-facilitating batterer intervention groups.
Wow. I had no idea that you've been in the same place for 40 years now.
Well, I'm not with Men's Resource Center anymore. But that work has kind of followed
you.
me. It followed me through my career. I've been doing it in one version or another. For example, in working with the adolescent sex offender program at St. Mary's Home for Boys was one of my jobs after graduation. And anger management is a component of sex offender treatment.
Yeah, it is.
And then working at as a clinical supervisor at Oregon State Hospital on a sex offender unit. It turns out that almost all of the sex offenders that we were working with there had documented histories of violence against women and children that needed intervention.
Yeah. So for anyone watching or listening, because you have such deep insight, I'm sure I'm going to have a question about this anyway, but since we're on the topic, can you help us understand what is at the root?
Well, that's a very good question, because the field of batterer intervention has shifted. So the first efforts, including what I was involved in, were called anger management. And so from that perspective, the root of the issue is impulse control and emotional regulation.
Yeah.
From that perspective. However, subsequent practice with the Duluth Project in Minnesota popularized a different view of the work, arguing that it is that the root issue is patriarchy and the training of men towards control of the women in their lives.
Okay, I did not know about the Duluth Project. I'm going to have to look into that.
So yes, so those were the first two kind of iterations, and just through my own work and exploration and discovery, I have really started to move towards the idea that there is not one root of battering. That there are many issues that are connected with it, that connected with men's mental health, that can contribute towards men's violence, and so now as I work with men, I really try to explore some diverse contributing factors, including the first two, and really try to more individualize the work rather than seeing batterers as one type that merits one particular focus or approach. So I would say that the root of battering it can be many, and it's just very diverse.
Would you say, if we could make a blanket statement, would you say that primarily it can be attributed to trauma or abuse in the home and how that was modeled?
I would say that is a frequent contributing factor. Yeah. I wouldn't isolate it as a strict cause and effect, but it's a major issue of basically unresolved trauma.
Yes.
And it can take that trauma can take different forms. It doesn't necessarily mean witnessing father abusing mother.
Yeah.
It can be many different things. There was one person who I was working with, and came in, and I said, "Well, what do you want to work on today?" And he goes, "I guess I should work on my shitty childhood." And when we uncovered that and looked at it, many of those things would not be considered trauma. They wouldn't show up on aversive childhood experiences, tests and assessments, but nevertheless, a series of just very strange and stressful interactions, inappropriate interactions that basically made for constantly stressful childhoods, like mom and dad going away to gamble and drink and leaving the kids alone in the house for the weekend with no food, and the kids are having to fend for themselves.
Yeah.
That was one of the things that he listed. That's not going to show up on trauma assessments.
Yeah.
But for him, it was a whole series of events. I asked him, I said, well, let's put together a shit list and work on it.
Yeah.
And so he listed 10 things on his shit list, and assessed them on a stress level of 0 to 10. And we went to work on those in that session.
Wow. Okay. So how did your early experiences shape your current philosophy or change responsibility? Let's see. And sorry, I'm trying to read this. Okay. How did your early experiences shape your current philosophy on change, responsibility, and healing? There, I got it out.
Okay. All right. Well, a major influence in my work was Miller and Rolnick's book, Motivational Interviewing. Now, that is mainly talked about as treatment for substance use.
Yes.
But I have found it to be an incredibly valuable resource for all kinds of issues. As a counselor in training, that the core of what we're trying to do is change. And Miller and Rolnick have a particular view that change and a person's motivation for change is a constant issue and theme, and needs to really be the center of the work that we do with people. And so a lot of what they're talking about is being able to pace your work and pace your interventions to a person's motivation for change. And if you try to go faster than your client, it's going to actually provoke resistance. And so Miller and Rolnick outline just a series of very practical little micro-level interventions to put the client in charge of the change process, and have the therapist more following the client's pace and motivation for change. And Miller and Rolnick believe that motivation fluctuates from day to day to work on an issue or a problem, and that motivation can be enhanced through open-ended questions and reflective listening.
I've had a few other guests who use motivational interviewing, and I'm currently waitlisted for motivational interviewing. Hopefully I get it as an elective this fall. And we did cover some of it as well when I went through training for becoming a peer wellness specialist. So I'm fairly familiar with it, but I appreciate you sharing that for people who are not.
Well, you have something to look forward to. It is the single most important book that I have read as a therapist.
Okay, good. Well, that's a pretty high recommendation.
Yeah.
I will definitely, I feel like my book list is fairly heavy, but I will absolutely make it a priority if I don't get into the class to absolutely read more about it.
Yes. A lot can be learned from trainings on motivational interviewing. There are lots of them.
Okay.
And it's just reading the book. It's a very practical book. It literally feeds you the kinds of questions to ask at each stage of change.
Awesome. And yeah, maybe we can talk afterwards about some of the trainings as well. I'm sure I can find them online. But if there's something that you specifically recommended, I'd love to talk to you more about that.
Okay, yes.
Yeah.
So I would say that my view of change and responsibility has changed as a result of reading that book. The initial work with batterer intervention, including the Duluth Project, generally follows what Miller and Rolnick call the confrontation of denial approach.
Okay.
They used to do the same thing with substance abuse.
Okay.
The idea that as long as you don't believe that you have a problem, then that's the problem.
Yes.
And that's
I'm
the
very
central,
familiar with that for substance abuse.
Yes. And so the clinical approach is to sort of marshal evidence that the person indeed does have a problem to overwhelm their resistance to the problem.
I like that.
And that's not a particularly effective approach because a lot of battering really comes from the common oppositional nature of human beings.
Sure.
We don't like being told what to do.
Or being confronted.
Or being shamed, being told you have a problem. And you have to agree with that whether you like it or not. And that actually provokes more resistance. And once I read motivational interviewing, I learned to start my work from the basis that if a person doesn't think they have a problem, then that's fine. Let's talk about that. Let's listen to that empathically. Let's ask some gentle but challenging questions around that to help the person reflect a little differently on what they have been doing. So, for example, it was not uncommon for a person to see me first at the intake. Like, no, I don't. That's not my idea to be here. The court's told me I have to be here, and it's a pain in the ass.
Or a partner did.
Exactly.
Yeah. I'm
going to lose my marriage. Well, instead of going down the road of, well, then you must have a problem, it's more like, well, your marriage, your relationship, that must mean a lot to you to go through all of this. Tell me about that relationship and why you would choose to go through this rather than just move on. You get a completely different response. And just following up on that, empathizing with the stress and the annoyance that going through counseling would put a person through.
Yes.
If they didn't think that they needed it, and then with me, the next step would be, and this may take 2 or 3 sessions to do, but the person almost always comes around. I'll start asking them, okay, so tell me other things about you. Especially what I want to do is go like, well, what do you like about your life? What don't you like about your life? And really doing some attentive, reflective listening around that.
Inventory.
Right, exactly.
And
doing that kind of
change.
inventory. Yes. And then, and what I am doing in a very gentle way is what Miller and Rolnick call developing discrepancy. The difference between the way my life actually is and the way that I want it to be. And once you have helped that person to recognize that discrepancy, then that becomes a seed for change.
Okay. What do you feel you are most naturally gifted in And how does that show up in your work?
I think I am most naturally gifted in curiosity, flexibility. In the programs that are not so successful, people keep hammering away doing the same thing. And if the client doesn't respond, if the client leaves or drops out, which many do, the clinician will say, well, they're not motivated.
Okay.
They weren't ready for change.
So what's your approach?
Forget about it. And my approach is well, what is there a different approach? Is there something that I could have done to approach it differently that might get a different response? So by persistently asking that question when I run into treatment failures, basically, I gradually learned to adjust my approach to where it's now 180 degrees from where I started.
It makes you better at what you do.
A lot better.
Yeah.
The main way that resistance shows up in batterer intervention is that dropping out of treatment. And places like the Duluth Project will say, well, the solution to that is having a tighter hold on the person so that there are real consequences if they do that. That way you keep them in therapy even though they don't want
to be it.
Yeah. So I would let me describe to you how frequent the dropout was.
Okay.
When I first started working at Men's Resource Center, of 60% of the initial intake appointments that I would schedule, 60% actually showed up. 40% dropout just from the initial phone interview to that first intake session. More would drop out between the intake session and group. And then in a group, you may start with 8 people, but after 5 sessions, you're probably down to 5. 4 or 5 diehards who stay with it, who really take to it. And you can say, well, that's satisfactory. You've weeded out the bad apples, the unmotivated people.
Sure. That's one way of looking at it.
Yes. Or you can say, what can I learn from this?
Yeah.
And so by the time that I was finished, you think of that fallout, losing almost 50% between the first phone contact and the initial interview, maybe another 25% before group even starts, and then another 40-50% in the first 6 weeks of a group. That's a tremendous fallout that we can learn from. By the time that I was finished doing that work with groups, probably about 15 years later, so a 15-year learning process, dropouts were almost unheard of. Like 90% adherence rate all the way through the process.
And were you handling the initial intake in that process? Okay.
Yes.
Okay. So do you still do men's groups?
I'm not doing group work right now. I don't have the volume in my practice to do that.
Okay.
There are also possibly some kind of external challenges with that because batterer intervention is kind of a regulated field. And to be doing it in a way that's approved as condition of probation, in some cases, you have to go through some trainings and things that will essentially require you to adhere to the Duluth Project approach. So for those 2 reasons, my work with clients is more individual at this point.
Okay.
But that's another thing with the 180-degree change.
Yeah.
It used to be, and sort of like the gospel of batterer intervention is group, 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 and only group. And I've learned to be more flexible in that approach. I think the group is incredibly powerful.
It can be.
And rewarding.
Mm-hmm.
But by the time I got good at it, men were looking forward to coming to group, and didn't drop out.
Mm.
But at this point, logistically, it's easier for me to work with men individually, and often it's not identified as anger management or batterer intervention up front.
Sure.
They're coming from other issues, and then you discover that
This is
down
part of
the
the
line
issues.
that anger is a core issue of it.
Would you say that most men have this as an issue? Let me refrain that. Would you say that most men have anger as an issue, even if they don't have issues with intimate partner violence? And how to display their anger, communicate their anger, process their anger. Would you find that that's consistently something that shows up?
Yes, I would say to some degree that's part of the issue. You could say that that anger is kind of like the common cold of men's mental health.
Okay.
It shows up everywhere, and it can have a lot of different reasons.
Sure.
But you could generically describe it as a common cold.
Yeah.
Even though a cold is different for everybody.
Yeah.
So. Yeah, so it's definitely a part of it, and one of the
laughing at all of the noise just all of a sudden.
Oh my gosh, yes. So you have leaf blowers and
in downtown Portland.
Here, yes.
Yeah.
And one of the reasons I think comes from the work of Terrence Real. And his
I love Terrence Real.
Yes, and his work
Wonderful
with men.
books.
So you know that he would say that that depression in men often manifests not with the dysphoria that we're familiar with, that we associate with depression, but through anger, irritability,
yes,
and mood swings like that.
Yep.
And if you start to look at it that way, it's you start to think about batterer intervention and anger management completely different, that this is actually depression in disguise.
Yeah, and it's a phenomenon.
Yes, it's a common phenomenon.
You know, you could say that it's at the root of all of the shootings, the mass shootings that we have here in the U.S. You could say that it's at the root cause of incel. You could you know, a lot of different things stem from men's depression and their inability to process those feelings, especially shame.
Yes.
And pain.
Yes, and the shame over having those feelings,
yes.
and not being particularly aware of those feelings,
yes.
not knowing how to articulate them. And I believe that comes from larger issues about the with the place of men in society, and a kind of social and economic displacement, and even a sense of exploitation.
Tell us more about that.
Well, Angus Deaton and Annie Case became famous about 10 years ago for a study showing a dramatic decrease in life expectancy among men, especially men in rural areas. And they attributed that to an increase of early deaths, untimely deaths, from what they call deaths of despair. Deaths of despair, basically from opioid addiction,
yes.
alcoholism, and suicide. Dramatic increase. So I ask myself, where is that coming from? Why is this happening?
Right.
What are the roots of that?
Yeah.
And so, like one of the trails that I follow on that is, wait a minute, how are 40, 50-year-old men getting addicted in rural areas, getting addicted to opioids in the first place?
Right.
What's the gateway?
What is the gateway?
The gateway is chronic pain.
Okay.
chronic pain. So you have men who are silently dealing with chronic pain.
Yep.
From physical or manual jobs, and not knowing how to deal with it beyond self-medicating, maybe trying legitimately through painkillers through their physicians, and going down that rabbit hole.
Yep.
So you start to think about anger management and pain issues, differently. Anger management, if you start thinking what we're really dealing with here is depression, we're dealing with chronic pain.
Mm-hmm.
And I can talk a little bit more about how I'm seeing that in my practice.
Please do.
One of the techniques that I've learned that is very, very promising with batterers, nobody's using it right now, but I'm working with it, is using eye movement.
Yeah, I have that written down.
I follow a practice, a training protocol called accelerated resolution.
Mm-hmm.
You can find out about that at acceleratedresolutiontherapy.com.
Mm-hmm.
And it's presented as a treatment for trauma, but it's also successful with other kinds of issues. And so a core method in accelerated resolution, similar to EMDR, is to use eye movement to help a person feel more relaxed or calm, but also to surface trauma in the body, so that you can then use eye movement to basically soothe the trauma in the body.
Yeah.
And so when I'm working with men, even when chronic pain is not the issue, they're there for anxiety or depression or anger, I do just some initial work with eye movement.
Mm-hmm.
And the first thing that comes up is I'll ask the person, so scanning your body from head to toe, what are you noticing? And the person will say something like, oh, well, this pain in my shoulder, but I'm familiar with that. That doesn't have anything to do with this. And, it's a chronic pain issue from work. And that comes up fairly frequently in my work with men,
Mm-hmm.
particularly men who have physical jobs.
Mm-hmm.
So that's the physical component of that can lead to chronic stress, premature aging, deaths from despair. Like I'm talking about men in their 30s or 40s,
Yeah.
who it turns out are dealing daily with chronic pain, even to the point where it disrupts their sleep,
Mm-hmm.
which becomes another problem, leading to mood dysregulation.
Mm-hmm.
So there's that. And that's with the people who have physical jobs. And the other thing, interestingly, is somebody told me this story. He went to his physician, Washington County, and he was concerned that he might be having some heart issues. He's like 40 years old, and the physician goes, "Okay, so you work at Intel, right?" And the guy goes, "Well, yeah, but how did you know?" And the guy goes, "You're in Washington County, you're in your 40s, and you've got a heart condition. That's Intel." So even people who are in tech jobs are facing chronic pressure, chronic stress,
Yes.
that is taking its toll on their body.
Absolutely. I come from the Bay Area in California, and I can absolutely attest to being in a executive assistant position, working with C-level executives, the stress level, the intensity that is in the corporate environment.
The competitiveness.
I'm sorry?
The competitiveness.
Incredibly.
The job insecurity.
And also trying to keep it, in the sense of taking a day off. You're looked down on if you have to take a day off, even for your children. It's unheard of. If something happens, you're just supposed to figure that out and show up anyway.
Yeah.
And the pace. And so, yes, I walked away from that position. My last position in the Bay Area, I was a senior office manager. I had 2 office assistants working underneath me. It took them the HR woman told me it took them over a year to find 2 people to do my job. And I ended up with Graves' disease, which is an autoimmune condition. I was diagnosed with that during that position. So to give you the idea of the stress, I've never worked so hard. I ran in that office. I ran to and from. So yes, I would agree that tech is incredibly intense and it's going on invisibly. Where, physical labor job, you can attribute construction. Okay, yes, I'm going to, hurt my back in some way, or I'm going to, and it's a physical ramification and I can point to that. But this is all internal and you can explain it away. I have heart palpitations. Well, I'm just stressed,
Right.
and just ignore until it becomes something that your doctor is like, oh, you work for Intel, or you're like, wow, your job is really stressful. Has that occurred to you? Yeah.
And then one of the interesting questions then in terms of gender issues and psychology is how does that stress move on down one pathway, show up in one way for you,
Right.
and a different way for somebody else.
Absolutely.
In one way, typically for women, and in another way, more typically for men, which is anger and irritability.
Absolutely. And I won't say that it was an angry or irritable.
Yeah.
Just so we're clear.
Yes.
Just so we're clear, that wasn't invisible to me. However, it was manifesting, as you would say, differently in my body than it would be for a man, for sure.
Yes.
Yeah.
And
because women process our emotions very differently than men do. And we tend to, although it doesn't always happen, but we tend to have more of a community to talk. Yeah.
Yes, and that is one of the things that I see show up in my work and my therapy with men is they're often very reluctant to talk. The title of Terrence Real's groundbreaking book is "I Don't Want to Talk About It."
Yes.
But in the end, they can't stop talking.
Yeah.
And
because someone's actually listening.
Because somebody is listening, because they don't have this kind of relationship with
anyone in their life.
Anyone in their lives, with any other man. And I even had one man say, I don't want you to take this wrong, but I wish that we could just go out sometime and talk, go to a ball game.
Yeah.
Yeah,
companionship is very different because it's a neutral environment that isn't provided in their friendships. Men tend to tease each other a lot, and they don't always talk about what's going on with them. Yeah.
Yes. So that becomes a big part of men's work, and that helps a lot with the irritability and the anger issues, is having a way to talk about those things in a constructive way and learning how to do that, which is different than complaining about the wife, complaining about the job.
Yes. Yes.
Because sometimes men think that's what that's what talking about it is. That's what it really means, and they may even avoid group.
Yeah.
Because they instinctively know that's not going to help. It's what sometimes in the anger management or batterer intervention industry, it's called the bitch tape.
Yeah.
In groups, you have to make sure that you divert conversations away from the bitch tape.
Yes.
The bitch did this. The bitch did that.
Yeah. Yeah. And I've even, I've had a partner say, I don't want to complain.
Oh, yeah.
I don't want to complain. And it's like, well, I'm not asking you to complain. I'm asking you to talk about your feelings. And if that seems like you're complaining, then okay. But ultimately, expressing yourself is the only way through.
Yes. And it's like the sore shoulder story.
Yeah.
It's like, what good is it going to do to talk about my sore shoulder? I can't quit my job. I can't stop working, and I can't make it stop hurting my shoulder. And talking about it is just going to make me more conscious of it, and it's going to make it worse. So why bother?
And so, how do you help someone with that?
Right. Well, that
tell us.
That's where the eye movement comes in.
Okay.
Because in that session, the next thing that happens is I have a person pay attention to just pay attention, just to notice that pain in their shoulder, and do a couple sets of eye movements with them, maybe suggest some imagery, and the person will go like, wow, that actually feels better. The pain is going away.
Yeah. Yeah.
And not that makes it go away permanently,
Yeah.
because eventually most people need to learn how to incorporate the power of eye movement into their daily life. Start incorporating some self-use with it.
Okay.
On a regular basis.
So you teach other people how to do this?
Yes, I teach them how to do it for themselves. It's not the same as having a therapist, but for some basic things like that, they can easily learn to do that.
Okay. So what personal hurdles have you had to overcome to do this work with integrity?
Judgment, just as a human being, recognizing the tendency to judge, the tendency to create this person as a monster, especially when they tell you things that are shocking and upsetting. So that's one of the things. For example, I once had a man come into group, and during our check-in, he acknowledged that he had slapped his girlfriend. And it's very upsetting to me, and it just sort of shocked the whole room in the way that he acknowledged that and admitted that. He wasn't bragging about it. But in fact, that was part of it, is me recognizing that there was sort of a hangdog kind of demeanor in the way that he acknowledged that just told me, like, confronting him on this is probably gonna just feed the problem. And so instead of following my reaction to judge or confront, I said, well, you've done this before. What was different this time? And it just kind of shocked him. And he thought about it, and he said, going into this, I knew it was going too far. I thought I really need to take that time out now.
Yeah.
And I didn't.
Yeah.
Now we've got something to work with.
Yeah.
Instead of him beating himself up, or him kind of getting me to beat him up over it.
Yep.
Now we've got a direction for change. But it really involved managing my own reflex.
Yes.
To say, you did what?
Yeah. Yeah.
Do you understand what was wrong with that?
Yeah.
How do you think she felt?
Yeah.
And
layering on the shame.
Yeah, exactly. And so that's one of the hurdles that I've needed to overcome personally. And then there's also an environmental hurdle that I've mentioned, that what I'm doing is very unconventional. And there are a lot of places and a lot of people who will say, what you're doing won't work. We know that it won't work. And,
I like that about you, by the way.
Yeah. Oh, the unconventionality. Yeah. And, and then my response will be, well, how do you know? What's the evidence?
Yeah.
And I never get an answer on that.
Yeah.
They'll just say something like, well, anger management doesn't work. How do you know? Let's take a look. What are the studies that you're relying on?
Right.
And so, the environment, I would say, is it can be hostile to the kind of approach that I'm taking.
Well, good for you for charging ahead anyway.
Yeah, I'm continuing to do it. I'm finding my place with it, but it's also why anger management is a part of the work that I do, but it's not the majority.
Okay.
It's not the majority of it.
Do you primarily work with men?
I work with men and women.
Okay.
But it's really interesting to see how men just kind of find me and gravitate towards me. And so a lot of my practice is with men.
Okay.
Even though I've worked successfully with women. Recently used almost exclusively accelerated resolution to work with a woman on stress with introvertal. Okay, now I'm losing the word, but IVF treatment.
Okay. Yeah.
In vitro fertilization.
Yeah,
There we go.
yeah. It's okay. I did the same thing with
Yeah.
intimate.
Yes.
Now I'm gonna do it. Intimate partner violence.
Yes.
Yes.
And so I'm working successfully on a lot of different issues with both men and women, and accelerated resolution is an important part of that. And the eye movement has some remarkably powerful effects.
Okay. So, how does acute stress disorder show up in this population? And what does constant life and death mode really look like?
Well, I've mentioned the chronic stress of employment, the chronic stress from, as my client put it, the shitty childhood, and let's see, what was the second part of the question again?
I pulled this from listening to you speak earlier, but I said, what does acute stress disorder, or how does acute stress disorder show up in this population, and what does constant life and death mode really look like?
Well, it can, a lot of it is the basic fight-flight response. There are other responses to trauma, freeze and friend. That's another F.
Yes.
But fight-flight is often a predominant one with men. But it can manifest, for example, in anxiety, and that may be what people who come to see me are the most aware of, is feeling anxious or stressed. And in fact, that may be the best way to approach this subject, is to ask the person to talk about stress rather than to talk about anger.
Yeah.
It can manifest in anxiety disorders, panic disorders. And so, for example, the person who started talking to me about his shitty childhood was actually initially came to me because of uncontrollable panic reactions related to a work accident or incident that left him feeling constantly in a state of emergency. So there was the current issue, but there was the fight-flight response that was ingrained from his shitty childhood. Anything can happen at any time.
Yeah, the other shoe dropping.
Yes.
Being hypervigilant. Yeah.
People feeling like their safety is constantly at risk. I worked with another man who self-referred for anger because of an issue of yelling at his kids when horseplay was getting out of control.
Yeah.
And he screamed at him, and his wife was like, "What is wrong with you?"
Yeah.
And working with him, and it took years to get to this, but it turned out that he had suffered medical trauma as a child. And he had mentioned it earlier on in the therapy, but I just wasn't on it enough to recognize the connection. But then especially when I got the training in accelerated resolution and was thinking more about trauma,
yes,
we did some processing around processing out really the medical trauma that he had suffered as a child, and
tell us the connection there.
The connection is somebody's safety is at risk.
Okay.
Somebody could die here.
Okay.
He had a severe
so the protector
medical,
was...
Yes, he had a severe medical condition where literally his mother said to him, you have to be in your room. You can't talk to any of your friends. I'm sorry. But if somebody even gives you a small cold, you could die. And he carried that message with him through his entire life. When his kids get a little too rowdy in wrestling with each other, somebody could die
get hurt.
here.
Okay. All right.
So what could have gone down the path of, oh, this is an anger management problem, this is a batterer. No, this is a survivor of medical trauma.
Yeah.
Who has been literally primed to see certain situations as life or death that nobody else would think of that way.
Yeah. You've mentioned many clients come in with overlapping challenges, sleep disorders, chronic pain, PTSD, substance use. How do you begin to untangle that? I'm going to move it a little bit closer to you.
Okay. So I think a lot of it is listening. Listening not only to the anger and the abuse, because, 180 degrees. When I started, that's all you ask about. That is all you ask about. Maybe substance use related to the anger outbursts, but really listening to more about their life and doing a broader assessment. And this just comes from experience of starting to hear some of those other issues now that may not get talked about. One example is attention deficit disorder. Once I really began paying attention to attention deficit disorder, I began to see how much it resonated with many of the men who come to see me. And attention deficit disorder creates a lot of disruption in a person's life, a lot of disruption for their relationships with other people.
Yes.
That don't get talked about. So a person is constantly trying to manage life and manage tasks when it's hard for them to pay attention to the same subject, or their thinking is so disorganized that it's hard to proceed on complicated tasks in a straightforward and efficient way. So constantly dealing with attention issues creates is a constant stress.
Of course.
Another example that I learned that I mentioned in the Alfortham training was head trauma. I never asked about head trauma 40 years ago, but now I've learned, first of all, that many of these men are engaged in risky work or risky lifestyle activities,
or sports when they were teenagers.
Sports, absolutely, and all of those can contribute. Now that we've been studying sports and head trauma with professional athletes, can contribute to mood swings and chronic pain.
Yes.
That a person is so used to they don't even talk about it. One of the most difficult cases I worked with, where the guy wasn't getting better, and I really didn't know enough to ask about some of these other things, but he happened to mention that he works with horses a lot, and I'm like, well, have you ever been thrown from a horse?
Or kicked in the face?
Right, yeah, exactly, because I'm thinking, why isn't this guy getting better?
Yeah.
He's like, are you kidding? I break horses.
Yeah.
I break horses. And they've broken me.
Yeah.
Yes, I have. Yes, I've had head trauma. I can't even count the number of times I've been knocked unconscious. And that clicked for me. It's like, oh, this is why you're not getting better. We're dealing with a physiological issue, and I didn't have a word for it then. It took me decades to come up with the word, to become aware of it, but it's post-concussion syndrome. Now I would ask him about headaches. I would ask him about dizziness. I would ask him about hypersensitivity to noise or light. Some of these other things. But when you're getting training from the Duluth Project or in anger management,
you're not developing the same kind of sensitivity.
Right. Nobody tells you to ask about head trauma. And that's happened in a number of things. There was another person who wasn't getting better in group, and I couldn't figure out why until he literally had a seizure in group.
Wow.
And then I started looking up seizure disorders and seeing the connection with mood volatility and irritability. I'm like, no wonder he's not getting better. His body's not going to let him get better until his seizure disorder is properly managed.
Right. What is the role of trauma in patterns of control and aggression?
Control is a way of managing chaotic situations that seem or feel like threat. Like the example that I mentioned of the person whose kids were getting out of control in their horseplay.
Right.
So control can seem like a solution to the problem of imminent trauma that is mostly in the person's own imagination.
Yeah. And living now.
Yes.
Taking over. Yes.
Yes.
Okay. You've talked about motivational interviewing, so I'm going to skip that. What is the danger in treating the behavior versus exploring the motivation?
You can really easily get into these kind of oppositional push-pull conflicts with clients. Yes, you will. No, I won't. And as soon as you're there, you've lost. You've lost that client.
Yeah, you have to let go of the rope.
Right. Yes. Exactly. You've lost it if you get into that oppositional kind of relationship. So another way of putting it,
if you try and do it in your partnership.
Yes. And so I think it's another way of putting it is figuring out how to build a collaborative relationship rather than an oppositional relationship right from the start. And that's what motivational interviewing does. It reframes the entire relationship. But I suppose related to that is maybe another question that I get a lot from women, which is, how can I get him to get help?
You can't. You either decide that you love him like he is, or you move on. You don't change a person changes themselves. You can make a suggestion.
Yes, or you can use the motivational interviewing technique of simple observation. You seem to be more irritable today.
Yeah.
What has something happened?
Yeah.
That has you more irritable?
Yeah.
You're
building awareness around it, you could say. But if that person doesn't want to hear it, then, or doesn't want to change, then you're probably not going to get them to therapy, is I guess my point. Yeah.
Yes, especially if you call it therapy.
Yes. What is the control wheel?
The control wheel is a very helpful tool that was developed through the Duluth Project.
Okay.
That outlines kind of a number of dynamics or a number of ways in which control can be expressed in relationships. So, for example, leveraging children, or vicarious ways of instilling fear, like having guns around, or venting anger on objects or other people,
or animals.
even if it's not directly against the partner. Control. Well, an interesting one is finances.
I'm very familiar with that one.
Yes. So, being in charge of finances, secrecy about finances, basically controlling the resource of money,
not
so
allowing
that the
other
partner does
partner
not
access.
Yes, exactly.
Or information about it.
Yes.
Yeah.
And I'm sorry, it sounds like it's all too familiar to you.
Oh, yeah. Well, I mean, you and I didn't get very personal, but I'll share personally here because anybody that has watched any other podcast is known. Yes, I was married and was in a relationship with someone for 22 years. I went through a 3-year divorce with this person, and I'm currently in appellate court. They filed for the appeals court to take a look at the judge's ruling. And you could say that it is financial abuse.
Yes. Protracted litigation is another very common form of control.
Yeah. Yes. Well, you could say that he is a textbook case. He's fired his attorney multiple times when he didn't like what he was getting, and represented himself and been in contempt multiple times. And yes, so delays and delays and delays the process, and emptied the bank accounts, that kind of thing. So certainly. Yes, I am very familiar with the control wheel. When you brought it up, I was like, yeah, I wish I would have known this about 20 years ago, but I know it now.
Yes. Well, I'm very sorry to hear that. And look at this. It's you can't get away from it. It's been 20 years and it's still hanging over your head.
It's been, I'm in 4.5 years of a divorce process. So that it's been more like, well, it's been since I was 26 and I'm 51.
Yeah.
So it's been half of my life. But it stems even earlier than that, which is why I'm so interested in talking about this with you, because I was trained as a child, right? So this is a storyline. This is generational. This is, ancestral. This is how my family deals with money. It seemed perfectly normal that he would deal with money this way when I first met him. And did it cause issues in our relationship? All the time. All the time, 100% of the time, 150% of the time. However, I was trying to build a family that I didn't have when I was a child. And so I worked very hard, not just at the tech industry job, but I worked very hard to keep this relationship together at any cost. And the cost was generally me.
Yes. And it's an ongoing cost. Like, how does that impact your current relationship, future relationships?
I was told, now we're getting really personal.
Well, this is what happens when you interview a therapist.
I love it. I love it. No, you can absolutely ask questions. And I'm very transparent, so I have nothing to hide. But I interviewed someone else to be a guest that I won't mention their name, but they used to teach at Lewis and Clark College, where I'm attending, and they no longer do, but have in their past and have been educated in every single kind of way when it came to relationships. One of the reasons why I was pulled or drawn to them is because I wanted to speak to them specifically about their specializing in betrayal trauma. Had a consult with them to talk with them about the podcast, but the only way I could get a scheduled call with them is to fill out their intake form. They read my history of partnerships and relationships. And the first thing that this woman said to me was, Andrea, I'm just going to be real with you. How important is a relationship to you at this point in your life? because you don't just have betrayal trauma, you have relationship trauma. You have never had a healthy relationship. So I don't know that you being in a healthy relationship would ever feel safe.
Mm-hmm.
So you could say that it is absolutely impacting me. It has impacted every relationship I've ever been in. It's something that I'm coming to terms with at 50. And I haven't given up on relationships, but it absolutely, to me, has cost. Every relationship I've ever been has cost me so much emotionally or financially. This marriage is, I think we're almost up to $400,000 in expenses at this point.
Wow.
So it has cost me a lot, you could say, and has impacted my future as well. So
It has cost you your life.
Yes, it has cost me my life
in a lot of ways. But I really encourage you to look at that, to look at the perspective that trauma is not permanent.
Yeah.
That the effects of trauma can be reversed, but it really takes a very focused and thoughtful approach. But what I've discovered with accelerated resolution is that trauma can be reversed. Even extreme trauma can be reversed very quickly by engaging a different part of the mind through eye movement, a part of the mind that can literally rewrite events from being fight or flight situations to situations that are controllable, manageable, and even positive.
I agree, because EMDR has been very, very useful for me. But I could say that any treatment has been very, very useful for me. The reason why I have been able to become a survivor of so much in my life, because I come from a family of all three types of abuse, is that I moved away and I sought out further education. I sought out therapy. I sought out therapeutic methods and interventions and evidence-based practices and even energetic practices. I've tried the whole gamut. I've always been willing to try. Similar to you, I've always had a fascination and curiosity behind why do we do the things that we do.
And it seems to me that in your work, from what I've read about it, you also focus on the spiritual healing as well as psychological.
I do. Not just the emotional and the psychological counterpart, but definitely, or the intellectual counterpart, but definitely the energetics behind it as well, because that's how we fully heal.
Yes, and one thing I want to, clarify for the viewers is when we talk about getting treatment for trauma, talk therapy is not necessarily a helpful treatment for trauma. There's a misconception that if you talk about it, it will eventually go away, and it may not.
Yeah.
As you know from EMDR, it has to be a therapy that focuses more on the trauma response.
Yes.
And reprogramming that ingrained trauma response more than rehashing the actual events that led you to learn that response.
Yes. And that's why I stayed away from going back to school and becoming, a licensed professional counselor, essentially, is because of talk therapy. But then I've come to the conclusion in my training that some people just actually need to be listened to, and that's okay too. That's okay too. Not everyone's looking to change their life in a session. Some people just need somebody that they can confide in, that they can have. You were saying earlier, some men just want to hang out because they're like, oh my gosh, I don't have this in my life. So that can exist. That and, right?
Yes.
Yes. Yeah.
Yes. And the trauma response needs to be addressed directly. So what I do in most cases, in some cases, there's not a lot of talk therapy.
Yeah.
In that
Same.
IVF case, there was not a lot of talk therapy.
Yeah.
It was literally reprocessing her experience with earlier attempts at IVF.
Yeah. Or trying to get pregnant in general.
Yes.
Yes.
Mm-hmm. And then, so in most cases, it's doing some talk therapy to ventilate, to bring some insight, but also for me
to isolate what
right,
the issue is.
Exactly.
Yeah.
I'm also thinking and making notes on what is the trauma response. What kind of language do they use that we can play with?
Yes. What beliefs do they have around this?
Yes.
Mm-hmm.
What is their metaphor for the problem?
Yeah.
That's a big thing.
How do they talk about it?
Yes.
What do they believe about it?
Right. Yes. And so, when a person talks about the problem, figuring out what their metaphor is for the problem, it becomes easier during eye movement to both soothe the kind of toxicity in the body around that negative metaphor.
Yes.
But once you've done that, then that creates room for them to shift the metaphor, and that metaphor automatically starts shifting, sometimes even without prompting.
Yeah.
So like I'll say, we'll work with the metaphor of the problem. I'll go, what's going on in your body? Let's use eye movement. Let's get the negative stuff in your body out until you're feeling good. Okay, let's go back and look at that metaphor again. And the person will automatically say, hey, it's different now, or I can't even
touch
see it
the same way.
Yeah, it's hard for me to even access that image or that picture.
Yeah, the reaction to it is
right.
lessened.
Or they'll say, wow, it's changed. It's different now. Mm-hmm. And, it's more positive. And so...
Or it can almost be a neutral memory, right?
Yes. Mm-hmm.
Yeah.
And so... and that follows that's the basic theme of my work, is really having it being generated by the client's own internal process, mm-hmm. and learning to facilitate that internal process rather than me doing something to somebody or telling them how to feel or what to image.
Well, and the reason why I was emphatically nodding my head earlier is because that was the conclusion I came to in my 30s. I kept going to therapy, and it's like, okay, well, yes, I know that my family's fucked up. Mm-hmm. Yeah. I mean, we could keep talking about this.
Right, exactly.
But,
I keep thinking that if I just
you
keep
and I are
talking
coming
about
to
it,
the same conclusion that I came to, 2 years ago with a different person. So
right.
Now what do I do?
Right.
Now that I know this, what do I do with this information?
Right. I thought if I talked about it, my response would change.
Well,
and it doesn't.
I didn't necessarily think that. I was, younger, so I was looking to the professional for the advice, right? But it kept showing up because it's like, well, okay, it's not getting better.
Mm-hmm. Yeah.
And I can put up better boundaries for myself and identify what those might be because, I grew up with not having any. But ultimately, if I have somebody who is fiercely dominant and wants to control, then they're not going to listen to that boundary anyway. Mm-hmm. What good is that going to do me? Yeah. So, yes, I'm with you on systemic change.
So in your training, does that make you want to, your experience, does that lead you to want to study EMDR or polyvagal therapy or something like that?
Yes. Mm-hmm. That's where I will eventually hope to be trained, as well as, it's a buzzword right now, but IFS, internal family mm-hmm. systems. Mm-hmm. Both of those are fairly... they're, to me, aligned with work that I was already doing. Mm-hmm. I already kind of do parts work, but I just didn't necessarily have the same kind of methodology behind it. So mm-hmm. To be clinically trained, mm-hmm. I will pursue, more education and mm-hmm. training. Absolutely.
And they can be used in combination.
Yes.
So accelerated resolution can kind of supercharge IFS.
Okay, good to know. Yeah.
Because it What accelerated resolution in general, what eye movement does, is it disengages the rational kind of argumentative part of your brain,
Yes.
the skeptic, your inner skeptic.
Yeah.
It kind of ties that up and allows your imagination, your creativity to have more license to explore, to imagine different options, different possibilities, different versions of the problem, different ways of looking at things, and also to access parts more efficiently.
Yeah. Yeah. I'm checking the time because we made it through my first 5 questions. It's so great. It's so great. Okay, let's see what else I wanted to ask you really quick. I think you've covered a lot of this. Yeah, you've been talking about eye movement a lot. So I think I kind of already asked this, but what's one thing people misunderstand about perpetrators of intimate partner violence as well as batterer intervention?
The most common misunderstanding is that it is one type of person. There's a real tendency, I suppose, to stereotype batterers, to stereotype sex offenders, to think that, as soon as you hear that label, we know who it is and what's going on with them. And I think that is it's just very far from the truth. People are way more complicated than that.
How do you work with belief systems like I've got to be a man? What questions help crack that open?
Often, well, first of all, those kind of belief systems are what one cognitive therapist calls metacognitions.
Yes.
One of the challenges with cognitive therapy is that it often focuses on more immediate surface level cognitions and altering those rather than really getting to the underlying beliefs. And that's what the Duluth Project gets right. And so it's so the first step in that is really uncovering those underlying beliefs, and you have to be a really good detective to hear those underneath and behind the words. There's a story I think that you may be thinking of that I told at the Al Fortham Project.
I don't remember specifically. I took down notes while you were speaking, so a lot of my questions have to do with my notes.
Oh, okay.
So if you want to share the story, please do.
Well, this was one of the most vivid ones. I was leading a men's group, and it was batterers, and it was a unique situation that the composition of the group was entirely men who had been referred there for violence with other men in community settings.
Oh, interesting.
And and so one of as we're gathering the group, one of the men is wearing a T-shirt, and it has the image of sled dogs, and there's a caption that says,
"Oh yes, I do.
If you're not the lead dog, the view is always the same."
That's right.
So if you're not the lead dog,
looking at the asshole, right?
Yeah, right. You're always looking up some other dog's butt. And I kind of laughed at it and complimented him on it. I thought this is we got to work with this. I'm going to ditch my agenda for the group. That's where the flexibility comes in.
Yes.
Let's talk about this. What does this saying mean? And so the men were kind of talking about it and agreeing. The importance of being the lead dog, that you don't like looking up somebody else's butt. You don't like having other people telling you what to do. And we're getting to that control issue as they're talking about this. And then I asked the important question, which is, so if we all feel this way about being the lead dog, what happens when you come up across a conflict with another man who has the same view, that he has to be the lead dog.
Yeah.
And so that, the lights started clicking on, and then they started talking about how do you deal with that? How do you resolve that? And I said, okay, let's go back. Let's talk about why each of you is here and make that connection. And that's when they really began to understand their problem in a different way, because they began to recognize that this lead dog mentality was leading them into irresolvable conflicts with other men, where the only solution was either violence or back down.
Zero-sum game.
Right, exactly. And so that's an example of how you can surface and challenge some of the underlying beliefs, like I have to be the man, is asking those kinds of questions, suppositional kinds of questions of, well, like, so what if you weren't the man in this situation in the way that you think of being a man?
Yeah.
What would happen?
Yeah.
And getting them used to that idea, or bringing in what we call in therapy the imaginary other. So who do you know or admire in the way that they handle conflict?
Uh-huh.
And what kind of man are they? What is their conception of manhood? And how do they exercise that in a situation like this?
What if you have a client that's like, I can't think of an example. I didn't have that person.
Well, sometimes that's the power of group therapy.
Yeah.
The group becomes that imaginary other.
Okay.
In fact, that situation with the man who slapped his wife, one of the things he said when I asked him, so what was different this time? He said, I thought about the group and I thought about all of you. But I didn't stop myself. I didn't take that time out. So the group or the therapist can become that I guess you could say role model.
Okay.
Or coach.
Okay.
And especially using eye movement, one of the things that you can do is introduce that coach as a way of reframing the situation. Once they have once they have processed out the toxic fight-flight reaction, you're wanting them to imagine that situation differently or to see it differently through the power of eye movement, and you can ask them to bring in someone who they admire or respect, and it can be an imaginary person. Sometimes a person will bring in Yoda.
Yeah, I've done this
to
in
talk them
EMDR.
through the situation.
Yeah.
Or sometimes it's the older, wiser self.
Mm-hmm. Yeah.
What I know now compared with what I knew then.
Mm-hmm.
Can coach them through the situation.
Mm-hmm. It's very powerful.
It really is. The example of medical trauma, for example, that client went back once we'd processed out the fight-flight reaction to the medical situation. He brought in his current self, who knows you're not going to die. You're going to get through this. You're going to be healthy. You are never going to have to deal with this again. And he had that person reassure him, counsel him, and coach him through the very painful medical procedures he had to go through as a kid.
Mm-hmm. Mm-hmm. I do something similar.
Mm-hmm. Yeah.
Like Gestalt.
Mm-hmm.
Mm-hmm.
Yes. And so the eye movement just supercharges that process.
Yeah, because it's rewiring the brain.
It's rewiring the brain, and more important, it's shutting off the parts of the brain that get in your way.
Yeah. And
kind of amplifying or intensifying the parts of the brain that can really help you to do that work.
Yeah. And I think you take it a step further, right? You're really isolating the belief or the cognitions too before you even begin.
Yes, that can be part of it.
Yeah.
Mm-hmm.
Yeah.
Because part of the question, I guess, getting back to your earlier question, is do the cognitions and changing the metacognitions come first, or do the metacognitions, are they more like the caboose and they follow when you do the other changes? And for example, your defusing trauma responses, do metacognitions start to change?
Well, what do you think?
I think it can work both ways.
Uh-huh.
I think it can work both ways.
It's like the chicken and the egg.
I guess, yes. And I guess through my work, because I have a bit of a cognitive behavioral focus
Uh-huh.
in the therapy that I do.
Is that
And
when you started? Were you more
yes,
CBT?
exactly. Because that's really the method of choice. And that's what people will say.
Absolutely. 40 years ago.
Nothing else works.
Yeah.
And I would say now I'm recognizing that direct challenge or confrontation of ingrained beliefs like that can even be counterproductive.
I agree.
You have to kind of sneak up on them.
Yeah. And disrupt the system.
Yes.
Mm-hmm.
Yeah.
Mm-hmm. Okay, let's see. These are more personal questions. Let's see. Make sure that you answered everything that I wanted to know about. Yeah, I think we covered most of the work. So, what's something you've learned from the men in your groups or in your private practice that has changed you?
I think doing any kind of therapy, whether you intend to or not, the training and the work that you do to get good at it makes you a better person, because you learn to be less judgmental, more patient, more compassionate, not just in the sense of oozing sympathy and love, but also a more analytic compassion of being able to understand more of what people are going through, and being able to, I would say, put some intellectual distance between a situation and your immediate emotional response. You learn to understand, and the understanding can help with the empathy.
Would you say that this also helps you have more compassion towards yourself?
Yes,
in your own experience?
absolutely. And it takes and humility. It takes a lot of humility and a lot of compassion to say everything that I was doing 40 years ago was wrong
Yes.
and counterproductive. And it takes a lot of patience with myself to be able to go back through all of these memorable situations with clients and say, if only I'd have known then what I know now.
Yes.
I could have done so much more.
Well, you
for
heard
this
me
person.
say it.
Yes.
Too bad I didn't know this 20 years ago. Yeah.
And what could I have done? Another example is a man who I was treating unsuccessfully for anger management. The situation entirely, every situation that he brought up that he was trying to manage, almost every single one was around dinner time, eating with the family, and being very controlling and irritable about noises that the kids and the family were making when they're eating. I didn't know about misphonia.
I told you about that.
That's right.
Yeah.
And
because I was never diagnosed with it, but I didn't realize it until I was in school.
Yes.
And I was like, there is actually a term for this?
Yes.
There's a term for everything now.
Yeah. And actually, I didn't assess for head trauma, but misophonia can be one of the responses to head trauma.
Oh, interesting.
So, but, if only
I did not know that.
Yeah. If only I had known then that I was treating misophonia, not a typical anger management problem.
Because it makes
I could have helped him so much more.
I mean, I was just... I'll speak personally. My ex-husband left 2 fish tanks, saltwater tanks in my home that I'm still, 5 years later taking care of, which is fine. I like the fishing and I'm not complaining about that. But it was every so often that, I have somebody that comes and helps me with it because I know the basics of taking care of it. But, I can change the water, et cetera. But I can't test the water and all of that. I haven't learned it to that extent. Or do I feel confident? And so I have someone that helps me with that. And sometimes when they leave, it adjusts the flow of the tank.
Mm-hmm.
Now, to most people, they'd be like, oh, that's just a soothing noise in the background. But I'll be standing in my kitchen and be like, that needs to stop. I cannot think about anything else. And then I start getting angry about it because I start to fiddle with it, and I get impatient with the fact that I can't get it right. And it becomes this whole thing. And I'm like, Andrea, it is just a fish tank. But overriding that is very difficult for me.
Yes, if that's
if I start to focus
yeah.
on it and focus on it and focus on it, the more I focus on it, I can get myself all worked up. And I think that actually is a large contributor to some of the migraines that I've had repeatedly over and over again throughout my life.
Yes. And so your EMDR therapist should be working with you around that.
I'm not seeing someone now. I'm in group therapy. I'm in a counseling program.
But another example is the person that I talked about with the horses.
Yes.
In the same conversation.
Horses.
Yes.
We had horses.
In the same
kicked.
Conversation when he talked about being thrown, hit,
times.
kicked.
Yes.
I
did gymnastics. I have a neck injury. I have all kinds of things.
Yeah. And so, when I talked with him about the effects, he said, yeah, noises bug me. Like, can you hear that sound?
Yeah,
I'm
I can hear it all.
What? What are you talking about? And he goes, that jackhammer. And I'm like 2 blocks away, and I'm like, oh, yeah, I can hear it a little bit. He's like, that is pounding in my head.
Yeah.
I can hardly pay attention to what you're saying.
Anything else.
Now imagine what it's like for that person who we label as a batterer to go through life with that every day, constantly in his head. If not actually happening, the anticipation or fear that it's happening.
Being around a table is very challenging with multiple people. Being in a restaurant with other people, having someone sit next to you. I mean, I think that's contributing for me as well, as long as we're talking about it.
Yeah.
I sat at a very tiny kitchen table with my family eating meals. A lot of trauma happened during those meals. A lot of trauma does happen at meals. But I was sitting at an antique table that couldn't have been more than 3 feet wide, and my mom was sitting right next to me, literally right on top of me. And then, my sister was sitting in the middle, and my dad, and we all had our spot. My dad and my other sister sat across from me, and we were right on top of each other during this meal. And it's not a surprise. I mean, I was sitting right next to my mom listening to her chew, and I didn't have a lot of control in my family. Actually had zero control in my family. So, the one thing, that I had control over was food and sound. And it makes absolute sense why that would be an issue for me or become a disorder.
Yeah. And a disorder around eating.
Yes.
And I thought about that also. It's part of what motivated me to work with this man with the misphonia around chewing. It's like, what is this like for his family to be literally eating their meals with a drill sergeant, trying to digest and enjoy when there's got to be this stress going on in the body at the same time. What is this doing to them physically and psychologically, and what can be the lasting impacts of it?
Well, it manifested a little different for me. I never would have externalized it. You wouldn't even have known it was going on for me because I was taught to not have feelings. So, of course, I was just like, oh, there's something wrong with me. I will deal with it. Yeah. I'm sure like irritability was showing up that I had very little awareness to what was contributing to that.
Yeah.
But he certainly wasn't a drill sergeant, I guess. I just want to, I feel like the need to defend myself all of a sudden.
Yeah.
My story was not his, but either way.
Yes. Well, that's the importance of doing the kind of work that
we do.
That you are doing as a client and as a therapist.
Yes.
You are healing levels of trauma and disturbance that have ripple effects on many, many others. And it's the work that I'm doing as well. And it's
powerful.
yeah, it's powerful, it's urgent, and we both have to be patient with our own learning curve around it,
Yeah.
and hopefully help others to through my teaching at Portland State, and through my clinical consultation, and through public service like this, to help other people kind of steepen their learning curve on it.
Mm-hmm. And it gives you purpose.
Yes.
Mm-hmm. And meaning.
Yeah, very powerful purpose.
Mm-hmm. Yes. I admire and respect the work that you do. I appreciate you sharing all of your wisdom and your accumulated knowledge and experience with us. You were delightful to listen to the first time. You've been amazing to speak with this time. Thank you so much for your time.
All right. Well, I'm glad to be here, and I'm glad to meet you, get to know about your work and your practice.
Yeah, thank you so much.
Okay, good.
Thank you so much for tuning in and supporting this podcast. Your presence here means the world to me, and I'm truly grateful for your time and energy. If this conversation resonated with you or sparked any questions, feel free to share your thoughts in the comments. I love hearing from each of you. Your insights, experiences, and curiosities always enrich this space. It's important to remember that trauma, often unseen and unacknowledged, can keep us from living fully in our joy. Through my intuitive healing process, I help release the weight of generational trauma, empowering you to reconnect with your true self and experience life in greater harmony. If you feel called to explore this deeper work, I invite you to book a one-on-one intuitive session, or even embark on a personalized journey with the Phoenix Immersion, a 2-day retreat designed to support profound transformation. You can find all the details below. For those who've liked, subscribed, or left comments already, thank you from the bottom of my heart. Your engagement means everything, and I'm deeply grateful for the connection we're building in this community. If you haven't subscribed yet, please consider doing so. I'm excited for all the healing and transformation we'll continue to explore together. As always, I'm forever grateful for you, and I cannot wait to see what unfolds next. Take care, and until next time.